Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott. August is National Immunization Awareness Month. Many of our younger friends and family members may struggle to recall the grim reality of infectious diseases. These were epidemics that really shook our parents and grandparents to the core. We're talking diseases like measles, mumps, rubella, poliomyelitis, tetanus, real threats to our survival in decades past that we don't think about much nowadays. We do, however, still see occasional outbreaks of infectious diseases, and these remind us of the importance of being properly immunized. This is particularly important for our children. Current California law requires that children entering school be properly vaccinated. A Senate bill called Senate Bill 277 was signed into law by Governor Brown on June 30th, 2015. This bill mandated that immunizations be taken care of in children entering school. In fact, the bill eliminated the so-called personal belief exemption. Our show today will focus on shedding light on immunizations. August is National Immunization Awareness Month, so this is a great time to focus on this topic. By way of background, consider this. In 1988, the World Health Organization documented about 350,000 cases of measles worldwide. In 2016, we only saw about 34 cases, which is a testament to the success of vaccinations. In fact, you can see that we still see some cases, however, that occur, particularly in South Asia and Africa. And we've even had, unfortunately, an epidemic of measles here in the United States at Disneyland and in a few other sites, which is really unfortunate. We also sometimes encounter other diseases that are preventable. I personally, in my practice, have rarely seen tetanus, but we have to be vigilant about it. It's preventable with a simple injection. Also, the World Health Organization voted to eradicate polio almost 30 years ago, but the disease still occurs sporadically in underdeveloped nations. You can see that on an image on a slide that shows the parts of the country where we tend to see this occurring, usually underdeveloped countries. Well, we have a distinguished guest today who brings clinical experience relative to practicing medicine and dealing with immunizations. Our guest is Dr. Shandi Fuller, who is a physician supervisor in Solano County. She's a medical doctor who serves as an outreach official for the county, and she's been gracious enough to join us as we discuss this critical issue. We hope that Dr. Fuller will shed light on the immunization requirements that might be of importance to our viewers of all ages. Welcome, Dr. Fuller. It's such a pleasure to have you on the show, and I know that you've been with the county for a while. Maybe you could tell us a little bit about your background and how you got interested in practicing medicine in the public sector.
Yeah, sure. So originally I'm from the East Coast. I grew up in Virginia, and that's where I did my medical school training. And early on, I got interested in pediatrics and also in public health. And so most of my career has been working in underserved populations. I've worked in the Cherokee Indian Reservation in North Carolina before moving out here to California, where, as you say, I work in the Solano County Solano County clinics.
So you not only have the expertise from your training, but you've actually been applying it in the trenches, as it were, in all sorts of locations with different patient populations.
Correct.
Well, you know, as I mentioned, Dr. Fuller, Governor Brown did sign Senate Bill 277, and this eliminated the personal belief exemption. I believe that we are now the third state in the union to eliminate that exemption. I believe there still are some exemptions for allergies to products in vaccination injections and so forth, but not based on personal belief. Is that more or less your understanding as well?
Correct. There's some exemptions if you have a medical contraindication, but other than that, there's no other exemptions.
Have you seen a change in immunization rates here in Solano County as a result of Senate Bill 277? Does it seem to be a positive influence on public health?
Yeah, so in Solano County, as well as in the state of California, the immunization rates were pretty high. But after Senate Bill 227, we did see an increase. In Solano County, we saw the rates rise to about 97%, and in California, it rose from 93 to about 96%.
I know that as physicians, we really like to kind of support families and kind of keep people together and working together in a therapeutic alliance. But let's face it, there was some opposition to Senate Bill 277. And I wonder, in your own practice and as a health official in the county, are you still getting any vibes that people are bothered by this Senate bill, or has it become part of the landscape, as it were?
Right. I felt like in Solano County, the public school system as well as the residents in Solano County are pretty much in favor of the bill. I haven't seen much resistance here. In fact, I've seen more kids come in and actually get vaccinated because of the bill.
And when you encounter resistance, do parents or family members elaborate upon that and say anything in terms of what they're concerned with?
Yeah, whenever I talk to a parent and they're reluctant about getting vaccinated, I ask them for the reasons why. And a lot of it is just wanting more information about the vaccines. Sometimes they want to just delay the vaccines. I rarely ever get a parent that just absolutely refuses to vaccinate here in this county.
Oh, that's encouraging. And what happens if a parent does, in spite of your best efforts to kind of explain the pros and cons of vaccines, if the parent just flat out refuses to get a vaccine and it's one of the vaccines covered by Senate Bill 277, what happens then?
Right, so if they refuse, then they will not be allowed to attend the public schools, but they do have an option to homeschool.
Okay, and have you ever encountered kids who actually wind up being homeschooled over this issue specifically, or is it part of a broader desire on the part of the parents to be homeschooled? Right,
and like I said, I haven't really seen very many who refused, and the ones that I've personally have treated were the ones who were homeschooling anyway.
Right.
So.
Okay. Perhaps I can ask you to update us a little bit on a few specific immunizations, which you as a pediatrician I know probably deal with all the time. So, for example, I mentioned measles in the introduction. Now, my understanding, and I'm a rheumatologist who deals primarily with adults, but I am aware that if you're immunized against measles, it's usually part of a combined immunization that we call the MMR, which stands, I believe, for measles, mumps, rubella.
Correct.
Okay.
Yeah.
Do you still generally recommend that as being a core immunization for kids, something they really must have?
Oh yes, definitely. Measles is still out there. We had an outbreak of measles in Disneyland in 2014-15. So yeah, I would definitely recommend getting vaccinated.
Okay. And it's a 3-for-1 vaccination, so if a kid is afraid of needles or the parents just don't want to get a shot, I mean, it seems like a real winner, because with that one shot, you're being protected against 3 potentially really serious conditions, against, again, measles, mumps, and rubella.
Correct.
So to me, it just seems like really a great idea.
Right, yeah.
In addition to being something that's mandated, so.
Right, exactly,
right.
Yeah.
Now, diphtheria, of course, used to be a real problem in particularly inner cities, areas with a lot of crowding, and I'm sure you've seen it as a pediatrician over the years. The diphtheria vaccination often is combined with the tetanus vaccination, right? We call it the DT. In your practice as a pediatrician, do you usually just administer diphtheria or DT or just tetanus, or how do you handle that?
We actually use the Tdap or DTaP, which also protects against pertussis. So again, it's a vaccine that has multiple uses.
That's great. And polio is something I want to ask you about also. I know that we do on occasion still see polio in third world countries. And in fact, this tends to be in areas in which there might be a failed state or a situation like that where the health institutions have fallen apart. But tragically, we still see polio, I believe, in Pakistan, Afghanistan, a few isolated pockets in sub-Saharan Africa. The reason I bring up polio is that most of us in this country who are, let us say, not over age 60, we might never have seen a case of polio, but it is in fact a devastating disease that's preventable with immunizations, right?
Right, right, yes.
So I think if we ever do see polio here due to lack of immunization, it would be quite tragic.
Well, and there are cases of polio. You know, there's people who travel and may come in contact with that, and if you're not vaccinated, then you are certainly at risk of getting polio. So just because it's not seen as often in the United States doesn't mean that it's totally eradicated. There's still polio in the world. So you have to be vaccinated in order if you want to be protected.
And I guess it's also worth pointing out that we live in an era of airplane travel.
Right.
We also have immigrant populations and migrant populations. We have refugees. We have people who are internally displaced in different countries. Mm-hmm. So there really are no borders when it comes to infectious diseases.
Correct, right.
And do you feel that eventually we might achieve the goal that the World Health Organization has established and really eradicate polio?
Well, I do, and I feel like we've made a lot of gains in the past few years, and we're, like you mentioned, we're not really seeing it, but in certain endemic countries, like in certain countries in Africa, and certain countries in Asia. So I think we're close, but we're just not there yet. And as you mentioned, you know, there's travel. It's very easy to go to different countries, so it would be unwise to say that there's no polio or that we're not at risk.
Okay. With respect to Senate Bill 277 and just immunizing kids in general, there's this concept of herd immunity. Mm-hmm. And maybe you could explain that to our viewers.
So herd immunity basically is saying that if enough people are vaccinated, then the unvaccinated people are going to be protected because they're relying on the mass of people that are vaccinated to prevent disease coming into that community or into that population.
But we don't want to see parents or family members relying on herd immunity to protect themselves. We want all these kids protected.
Correct. So there's certain populations of people that are not able to get vaccinated. Right. So for instance, pregnant moms can't get certain vaccines, as well as immunocompromised patients, patients with cancer, and infants. So those populations of people are can actually benefit from herd immunity. But you don't want to rely on that because for the people who can get vaccinated, if they don't, then they are vulnerable to getting disease. And not only will they get sick, they put others at risk. So they put the cancer patients at risk and other populations like that.
Right. And also, no immunization is perfect. So you're going to have a few people who just don't respond to the immunization. Right. And so everybody really benefits from immunization, even other people in the community. So that if I, for example, am immunized against influenza as a doctor, I'm less likely to spread influenza from one patient to another. So it's not just for my own protection. When we get immunized or vaccinated, we're protecting the whole community. That's the point I'm suggesting.
Right.
Do you agree with that?
Yeah, I do.
Yeah. And I'd like to turn now to the concept of avoiding immunizations in kids. One of the issues that sometimes comes up is this concern that, for example, there are side effects of immunizations. One would be, for example, the MMR being associated with autism. Mm. And I believe that the original studies on that have been largely discredited. Mm-hmm. Could you comment on that, Dr. Fuller?
Yes, there's been several studies that have come out about that. And the thing about MMR, the MMR vaccine is given at the same time that you would normally see signs of autism. But since then, there have been multiple studies as well as statements from the AAP and the CDC stating that there's no linkage between autism and any vaccine.
Yeah, that's very reassuring. I think that, unfortunately, when you have false information that gets out there, or information that is later just disproven or viewed as no longer current, even if it's not overtly false, it's really hard to sort of disabuse people of these beliefs, and that's why I think education is so important in this area. So yes. I appreciate your clarifying that. I believe there also has been a concern about some preservatives in vaccines. It used to be, for example, that thimerosal was used, and this contained trace amounts of mercury. Mm-hmm. Is this a concern anymore?
Well, so now all of the childhood immunizations can be prepared without any preservatives, so it's not much of a concern. But the ones that were, they did do studies on the preservatives in vaccines and found that it was safe to give.
That's great. Now, there are live attenuated vaccines. I believe polio is one of them.
Right.
Traditionally given by the injection, which was named after Jonas Salk, and then replaced by the Sabin one, which was the sugar cube given orally. there was a concern that rarely you could see a form of polio develop as a result. I believe it's generally 1 in 20,000 injections, something like that. Is that still a concern?
So in the United States, we don't use the oral polio vaccine or the active polio vaccine, and what you're referring to is a side effect from the oral polio vaccine. It's a polio-like illness. But so in that regard, we don't really have, there's not much of an issue because we're using the inactivated polio vaccine here.
Okay. And I'd like to talk about some of the older kids too. One of the new vaccines that I'm very excited about, I think it's really a game changer, has been the vaccine against human papillomavirus, which not only prevents, I believe, the most common sexually transmitted disease, or one of them at least, genital warts, but also prevents genital cancers. Can you enlighten us a bit about that, Dr. Fuller?
Yeah, I think when you're talking about HPV, you should really focus on that. This is a cancer-preventing vaccine, and that's really powerful when you think of it like that. And so when we vaccinate, we want to vaccinate children before they even are exposed to HPV. So we want to vaccinate early, around 9 to 10 years old, before they ever become sexually active, before they are ever exposed to the HPV virus, so that they can potentially be preventing cancers.
Now, if a parent says, well, I don't want my child immunized because I want my child to practice abstinence, how do you address those concerns? What's your response to that?
Right. So again, abstinence is great, and this is a vaccine that you're going to give to a 9 or 10-year-old. So before they even are thinking about becoming sexually active, that's when we want to get those children in, so the chances of them being exposed to HPV is less, and we want to get them vaccinated before they are exposed.
Very good. And Dr. Fuller, could you comment on some legitimate contraindications to immunizations, like I believe egg allergy might be one?
Right, so there's very few contraindications for vaccines, and you can look on the CDC website for those, but egg allergy isn't actually a contraindication. So things like pregnancy and live viruses, or immunocompromised and live viruses, are contraindications.
Yeah, I know we exercise caution using some immunizations in patients in rheumatology who are on so-called biologic agents where their immune system is depressed. So,
right.
But that would be relative, not absolute, and you could find a way around that if necessary. I think it's worth pointing out that there are other aspects of health prevention besides immunizations that we have to also use, like hand washing, hygiene, healthy diet, and there's nothing about getting immunized that makes those any less important. Would you agree with that?
Yeah, definitely. I mean, you have to think of the whole person. So of course, hand washing is very important so that you can prevent the spread of illnesses and so that you yourself won't get sick. Healthy lifestyle is just a foundation that we all should strive to achieve. So that includes a healthy diet, that includes exercising, and just overall just being healthy. So yeah, I would definitely agree with that.
Well, in our limited time, Dr. Fuller, we can't really cover all immunizations, but I tried to address a few. If our viewers or other individuals in the county want to find out more information on immunizations, I believe that you do have a website. I know there's one that is run by the Centers for Disease Control, www.cdc.gov, but I believe you also have some areas where individuals can search for information through Solano County, either by phone or on the internet. Is that correct? Yeah,
so you can go to the Solano County website, www.solanocounty.com, and get information. And the telephone number is 707-784-2010 is to our clinics, and you can get information from there as well.
Yeah. And I think the message is getting out about the importance of immunizations. I've seen data that shows that since SB 277 passed, the immunization rates routinely in kids entering school in California have gone up from somewhere around 92 or 93% to closer to 96 or 97%, and we have data on that. So
Right.
You must be doing something right.
I hope so, yes.
I think many things right, in fact, so we appreciate your service.
Thank you.
Now, do you track things like, for example, outbreaks of disease in the county, like measles, mumps, rubella?
Yeah, so they do tracking. We have epidemiologists that help us with those kind of tracking. So yeah, we monitor that.
And of course, it's early to be thinking about it, but in the fall we're going to have flu season as a concern again. I've always felt that it's just really a great idea to be immunized against influenza. We discussed it briefly before. I think we have something still like 15 to 30,000 deaths a year due to complications, pneumonia, and so forth.
Right.
I'd certainly like to see those numbers lowered for all ages.
Right, so would I. And yeah, it's very important to get your flu shot every year. And I think it's important that people remember to do that and remember that it is a yearly shot.
Now, does the health department in Solano County provide immunization services directly to the public?
Yes, so we have clinics in Fairfield, Vallejo, and Vacaville where we are able to give immunizations. And for children, the immunizations are free through our partnership health plan and our VFC program.
If someone wishes to access that, should they go to your website or telephone or?
Right, and you can go to the website that I mentioned earlier, and as well as the telephone number that I mentioned earlier, and we'd be happy to see you.
One thing else I should ask about is, how about members of our community who may, for example, not be comfortable in English? That would tend to often be, for example, Spanish-speaking persons. Do you have any special services for them, or any way that they could access health care in their own language?
Right, so in each of our clinics we have translation services as well as translators. So and Spanish is one of the languages that we are able to translate in. And we also have materials written in Spanish. So if they wanted information on vaccines, we do have materials in Spanish for that.
One other vaccine that I should ask you about, since I have you here and you're an expert in this area, has to do with chickenpox.
Okay.
Now, of course, chickenpox is something that people in my generation just grew up with. They got chickenpox and that was it. We don't see much of that anymore, do we, with this excellent vaccine against the causative virus, which is called varicella, right?
Yes.
And when you administer the chickenpox vaccine for kids, tell us sort of more or less how that's administered. How many injections?
So there's 2, okay? And like you said, the reason why we don't see the chickenpox is because of the vaccine, and it has a really good effective rate. And so, but you do get 2 doses of the chickenpox.
And another thing that people forget about is that the immunity to chickenpox wanes with age. So I realize your field is pediatrics, but as you get into the older age groups, there's also now a vaccine against shingles. And shingles is really a reactivation of the body's chickenpox virus, which sort of hides out in the spinal cord and comes out again in old age.
Right.
I think that's another one that's really important to mention, not for the pediatric population, but for some of our viewers. And similarly, we have immunizations now against pneumonia, for example, Pneumovax.
Right.
Certainly older people with chronic lung disease and other problems would benefit from that.
Right, exactly.
Maybe in our closing moments, you could share with us, do you see anything on the future of vaccine development that's really exciting, particularly for kids?
So you never know. There's always something developing in the future. You know, there's a lot of emphasis on meningitis and where that's going to go in the future. You know, there may be some more vaccines related to that. But I think, you know, as we go along, we're going to hopefully see a decrease of these illnesses in the population, and hopefully the vaccine rates will continue to rise.
Now, you mentioned meningitis. Kids who are still pediatric in the sense that, you know, they're under age 18, but they're moving off to college or going into these environments where they're going to have contact with a lot of people. Do they need boosters for meningitis, or? Yes.
So we do recommend, so meningitis is one of the 11-year-old, we call it, vaccines that are given at 11, but you do need another booster around 15, 16 years old, right before, you know, you're thinking about going off to college to help be protected.
Okay, well, thank you so much for joining us, Dr. Fuller. It's been a privilege to have you on the show. You've offered us just tremendous insights, and I think it's really been so helpful for our community. And I'd just like to ask you, how do you keep all these vaccines straight? I mean, my gosh.
Well, there's definitely a lot of resources that you can refer to. So we do the same thing. We have our charts and we have our literature that we keep on top of, and our CMEs that we keep on top of. So it's a lot of learning, but we try to keep on top of these things.
Well, this has been just a tremendously enlightening interview. We really appreciate your taking the time out of your busy schedule to provide just such an expert commentary on such an important topic. We really appreciate all the fine work you're doing as a physician at Solano County.
Thank you.
And on behalf of all of us here at Health Focus, I'd like to just say to our viewers, we wish you all the best as you pursue your own health. It's been just a pleasure spending time with you, and I hope you continue to just have a wonderful and healthy summer. Thank you very much. Goodbye.